Thank you, Marianne, for the kind introduction. Ladies and gentlemen, dear colleagues, it's a pleasure to be here. Thank you very much for inviting me. I would like to present a full cohort analysis of our investigator-initiated Ranger SFA registry and give you also some detailed aspects on the still ongoing intensive analysis for these drug-coated balloon. Here's some disclosures. So just to summarize, the Boston Scientific Ranger drug-coated balloon technology is based on a Sterling balloon platform using the Transpax coating technology, in which the paclitaxel of 2 micrograms per square millimeter is embedded. So the size matrix, especially for the SFA, is 4 to 8 millimeters, up to 200 millimeters. This is usable in the European countries, below the knee up to 4 millimeters and up to 150 millimeter in length. There is an intensive analysis going on for the drug-coated balloon technology, for the Ranger drug-coated balloon. Here you see the studies which are going on. There's the first-in-man trial, a prospective multi-center randomized trial, shows some data later on. The pivotal trial, prospective multi-center randomized control trial, and also a trial in China. Here are the data which are recently published for 6 months, and I can also show you 12 months data for the Ranger first-in-man trial, which was led by Dirk Scheinert, which was a prospective randomized multi-center control trial, 2-to-1 Ranger DCB versus uncoated balloon. Here are the primary patency analysis, 12 months patency analysis of this first-in-man trial, which shows a primary patency of 86% after 12 months in comparison to the control group, so proving a high good performance of that stent after 12 months. Here's the freedom from target lesion revascularization presented, 91% after 1 year in comparison to the control group. Beside of that, an intensive investigator-sponsored research is on the way involving hemodialysis, AV, fistula, usage of the Ranger drug-coated balloon, a compared trial. And I would like to focus now on the prospective multi-center registry trial and present you data on that. So this trial is a multi-center prospective all-comers trial. Centers from Switzerland, Germany were included. 180 patients were treated in the trial, and primary efficacy endpoint was defined as primary patency at 12 and 24 months, defined as freedom from restenosis as indicated by duplex ultrasound peak systolic velocity ratio. Most of the patients were claudicants, and some critical limb ischemia patients could also be included, and inclusion criteria was up to P3 segment. As this is an all-comers registry trial, we just set up a standard of practice, DCB transit time lower than 30 seconds, DCB inflation time optimal up to 180 seconds, and the DCB angiographic vessel diameter larger than 1. These are the patient demographics of this registry, showing a typical cohort patients with peripheral artery disease. Most of the patients, as already mentioned, were claudicants. Most of the patients had a Rutherford stage 3 symptomatic situation. Here are the lesion characteristics. Patients were treated in the SFA, and some of them also in the popliteal artery segment. As this was an all-comers registry trial, the lesion length is, of course, a little bit longer than in controlled and randomized trials, 129 millimeter total lesion length. Patients also with moderate calcifications were included in that trial, and having the lesion length in mind, you can see that the TAS C and D patients are a little bit overrepresented in that trial. Having said that, the lesion length was 129 millimeters long. You can see that bailout stent rate of 22% is, I think, quite acceptable and typical for that lesion length. And when you bring that in comparison and perspective with other registries, and trials, you can clearly see that this is totally in line with other DCB studies. Here are the primary patency analysis after 12 months for this SFA all-comers registry. You see after 6 months a primary patency of 91% and after 12 months 84%. Freedom from target lesion revascularization after 6 and 12 months are shown here, 92% after 6 months, 89% after 12 months. Patients improved, of course, significantly after 12 months. 86% of patients moved up at least one Rutherford category, 69% of patients moved up larger than 2 Rutherford categories after 12 months. Here you see the ABI improvement at 6 months on the affected limb and the control limb on the other side. And here are ABI improvement after 12 months, showing a highly significant improvement also for the ABI. Typical case example here from this registry, patient with a long SFA occlusion, kind of calcification. After POBA predilatation, a 3-minute Ranger drug-coated balloon angioplasty, and this patient was scheduled back because of a problem on the left side, in-stent restenosis. We also focused on the right side, and you see after 11 months, a very nice and very good outcome after 11 months. This patient having used the Ranger DCB without stent implantation. So let me conclude. We have consistent results between the Ranger DCB registry, our prospective all-comers trial, and the first-man randomized control trial after 12 months, and our results show that even in long lesions, complex lesions, thus C and D lesions, we have a very good primary patency at 12 months and also a very positive target lesion revascularization rate after 12 months of 89%. Thank you very much.